Scientists say it is normal for humans to have slight change in body temperature after a long while. The changes in body temperature result in illness, which may require a combination of drugs for the body to return to its shape. The drugs required to treat a sick person under normal circumstances ought to be prescribed by a medical doctor after a careful diagnostic analysis of the person's sample. Question, however, is why do people prefer to self-medicate when they are sick or feel sick?
So if you are sick, where do you get your drugs?
At times I get it through chemists.
If I'm sick, I used to go to pharmacy and buy.
The respondent blame it on the rigorous processes to see a medical doctor as well as the level of negligence by health workers among others.
Because they will tell you, wait, doctor is not around, or wait, go and buy a card before they will attend to you. So that's why I prefer going to pharmacy to buy drugs anytime I'm sick.
2010, I lost one of my daughter. So the girl was sick. So I take her general hospital. Instead of them to attend to me, they were complaining that whether me I give them, I don't already. Say since when this thing start? I say it started today. They say it's a lie that I have been giving her native medicine. They say I should come. They prescribe a drug for me to go and buy. Before I come, I lost the baby.
That can be on the queue. Let's say somebody has a stomach ache. You want to check what is wrong with your stomach, and you'll be on the queue for an hour.
Irrespective of the challenges associated with seeking care, especially at public health facilities, are there people who will not self-medicate until they are examined by health experts.
It's not even advisable to go to chemist and buy drug when you are feel sick. The first thing to do is go for test, because somebody may have a headache because of the stress, and you wait and get Panadol and begin to take. It may not work for it.
It will be some in form of drug abuse, because if I don't know what is happening. Maybe I'm feeling pain in one side of my body. If you go to the hospital, they will test you and know the particular sickness.
They call on government to upgrade health facilities, especially with manpower.
I want government to equip our hospital. At least let there be enough doctors, nurses, especially for children.
What I would like to tell the government is that they should, if they can, delegate some people to the hospital, so that because the kind of manner and different things that we are facing in the hospital.
Dr. Omweke Segwe discourages self-medication. He says it destroys vital organs of the body.
Also health implications that many individuals fail to recognize. We've seen increased incidence of end organ damage, liver failure, kidney failures in people. Personality change could occur in people who actually take recreational drugs, and this could result in increased incidence of personality disorders as well as other mental health disorders. Also, with respect to antibiotics, taking antibiotics without doctor's prescription or overdosing on it actually has been linked to an increased incidence of antibiotic resistance.
Healthy population determines healthy workforce, and healthy workforce largely determines a buoyant nation. And to achieve this, relevant stakeholders, including the Federal Ministry of Health, is expected to fashion out ways of discouraging self-medication by ensuring health facilities at all levels are not only upgraded, but have adequate health workers that will be available and ready to attend to all patients. Joseph Kadri, ITV News, Abuja.